Hi everyone, thanks for hanging around. My name's Kathryn Dalmer. I'm a final year medical student from Wollongong, and the research that I would like to speak to you about was actually my part of my degree, but it's actually was one of the big surprises for me was that no one had actually studied this topic nationwide before I decided to do it as a student research project, which is one of the reasons why I think I was accepted to be here today. Work this thing. So basically, why do we even need Indigenous cultural training? As we've heard throughout this conference, and as most people who work with Indigenous people already know, the burden of disease of Indigenous people is extremely high, 2.3 times higher than the general population. We've got lower preventative health service use, higher rates of complex primary care needs, higher rates of preventable disease, and higher rates of preventable hospitalisation. But Indigenous people can go to their GP just like anyone else, right? I think everyone in this room knows all the barriers that we've been speaking about since we've been here, to why that is. The interesting thing, as I mentioned already, was that, how do we know that, like, our general practitioners actually geared up and keyed up to and skilled up to manage their Indigenous patients? No one had actually studied this throughout to look at this as an Australian cohort. And when I did a literature review, there were only 9 articles regarding Indigenous cultural training on even really small studies in isolated areas. And the majority of those were from, there was like a number from Mount Isa, and there were a couple from Western Sydney. And then they were really just scattered, the other couple that were around. So not even a representative in that group of 9 studies of things that were going on across the country. And even though we've got, just trying not to read my slides, all these issues with Indigenous cultural people, Indigenous Australians, we just don't know how well GPs are prepared for addressing all of the issues. The aims of my study were to look at the source of GPs' Indigenous cultural training, whether their models for provision were adequate and relevant to the practice, because I think we all know how when you go to a training session, you want it to actually relate to what you do in your day-to-day work. What barriers exist to accessing training to overcome knowledge gaps? And an idea that I had in coming into this as an Indigenous medical student, soon to be doctor, was that if there would be room for a novel support consultation service with Indigenous doctors. The methods that I used was a survey. I developed an online survey tool through using SurveyMonkey. I did this through first approaching key national organisations. So I gave ACRM a call, had lovely conversations with Professor Lucy Waters and other people in this organisation. I spoke with AIDA, I spoke with the Indigenous section of RACGP, and I also spoke with a number of Indigenous doctors individually. Out of that, I came up with 8 demographic and 8 exploratory questions exploring Indigenous cultural training. Now, my main thing was I'm surveying GPs. Everyone's got survey fatigue. I wanted to keep it as short as possible. So I was actually a little disappointed that it blew out to 16 questions, but it was the recommendations. So to make sure that this was going to be a study that could be transferable, I did a pilot study. I read aloud for people who are not into this sort of type of research. It's basically where you sit down with the people in the pilot study, you get them to basically express their thoughts about the questions as they're reading them, as they're doing them, so that you can incorporate those, make sure that whoever's going to do that online, that the questions are answering, the answers are going to give you, the answers given are actually going to be the question that you've asked, and also that it makes sense, obviously. I made sure that there were no GPs included in that study. After that, I distributed the surveys through an online survey. Sorry, stumbling on my words here. Basically, links were sent out to all GPs across Australia. ACRM helped with that, and so did RACGP. So I did that through using their online weekly newsletters. Some of you may or may not have seen that or even answered the survey. Thank you if you did. One of the key things was that when I sent this survey out, I tried to piggyback on the national sort of campaign of Closing the Gap, and I timed the release with the 10th annual report of Closing the Gap, thinking there'd be a lot of Indigenous focus. I don't know, anyone in the room want to guess out of all of those GPs across Australia how many answered the survey in that first couple of weeks? Anyone brave enough for a figure? Good guess. I would have been really happy with 200. Bingo. Yeah. So what I did next was, this way I have this table and you can see the dates of progression along the table. I went to the power of social media. Then I approached various people to help me get access to GP-only pages like GP Down Under, other things, the Medical Mums, some other things that went out. And also ACRM put it on their surface page for the college and other things like that. And in the end, well, when we get to results, you'll see how many I ended up with. But it was really just I tried my best to get it out there, but no one likes doing surveys. That's a few examples of the different things and the different avenues that I tried. AIDA actually made me a member, the member story of the week, to try and get things out there. You can't ask for much more support than that. When we got to the analysis, I used descriptive and inferential data analysis with MS Excel. And the open-ended questions, I used the basic grounded theory approach and applied something called the trustworthy criteria. That's a criteria where you really go through quite a 6-step process to make sure that everything is transferable for any future studies. Now, here we go, the results. 130. If I'd have got that original 200, that would have been great. So, small sample in the end, but I was actually so surprised when I started doing the number crunching that all the data was transferable. Had the right number of GP to GP registrar ratios, had the spread across the nation in proportion to population percentages, had even though I was really a little anxious about how many GPs that were Indigenous that would answer because of the push through AIDA, it ended up still pretty good. Much higher, but not as bad as I was predicting. Most GPs that answered the question were in GP rooms. So, in looking at that further, the sources of knowledge to answer those questions that I was wondering about. Also, probably not surprising to people in the room, most people got their experience of Indigenous socio and cultural economic knowledge through their professional experiences, their face-to-face trainings, and their personal experiences. So I think it really shows us that that interpersonal approach with Indigenous people has got such powerful effects on everyone. The relationships between their knowledge acquired from training and other sources and their management of Indigenous people showed that respondents, actually the ones that answered this survey, all saw Indigenous people regularly. 77% saw them most weeks, weekly or daily. and nearly 3/4 of correspondents, 74.6%, agreed or strongly agreed with the statement that their knowledge about Indigenous culture was adequate and significant to the interactions they were having with their patients and the medical outcomes that were happening. So, when looking at the aspects of care, it was chronic disease thought to be the most significant. But what I actually love about the information that came out of this was even where someone's having an acute, looking at acute care, we still had over 75% of respondents stating that they felt that their knowledge of Indigenous culture was really pertinent to the care that they were going to provide and that it really helped. And looking at strategies employed by GPs to address any knowledge gaps, comes back to how they got the knowledge in the first place, was really about that existing professional relationships and interpersonal interactions. Quite reassuring for the GP member, for the GP services, that those resources that they provide are actually really well utilised as well. More than 70% of people used resources from their organisation. Interestingly, the face-to-face training and online resources were less popular than that personal interaction. And anyway, I don't need to read that, you can all read that. Barriers that people come across. The most likely barriers, no surprise to most people in this room, time constraints. If you don't know the training's on, that also might have an impact, and whether those two aspects were mutually exclusive or dependent on each other is something that I think needs to be addressed in a further study. But the least reassuringly to me was that the people who are interested in working with Aboriginal people, they're not going to do a training or they're not going to do anything just to get a CDC point. There's sort of, there is an underlying current that people do things like this for just to tick their box. And if you're actually interested, you're obviously interested for different reasons. The applicability of the training content was interesting as to whether this was a barrier or not, because 40% of people felt that was a barrier and 39% of people thought that it would not be. So I don't know, whether we can infer anything from that, whether it's got to do with past training experiences or not. There you go. My last aim that I wanted to answer was if there was scope for a cultural consultation service with Indigenous doctors to help Indigenous GPs with any insights. And 60% of people that responded to this survey said that they definitely would be interested. But as also you guys have heard throughout this conference, and I would already be aware, there just aren't enough Indigenous doctors to be able to provide the service at this stage. So with only 0.43% of GPs being Indigenous and the majority of those being registrars in training, we might have to revisit this idea in the future when we get more Indigenous GPs. The qualitative data analysis was really interesting. I had 45% of people that answered the survey actually really gave so much information and extra writing, really passionately, things for cultural training, really passionately things against cultural training, and they even used areas that were supposed to be like just a one-word other to just give full paragraphs of opinion. So I ended up coming up with 3 main themes, and I've just summarised it, just pulled a couple of quotes out for you. But the 3 themes were interpersonal interactions as current knowledge sources, negative training experiences, and there was a number of calls for enhanced, more locally specific training opportunities to build workforce and cultural capacity. So what does it all mean? As I said before, this is the first time anyone had even looked at this kind of thing across Australia. The cohort was small, but I think we can transfer the results and that we can make some adjustments to training. We also know that from this that despite that there is a huge range of resources that GPs use, which I don't think that's surprising to anyone in the room. GPs are very resourceful people. But the fact that so many people viewed Indigenous culture knowledge as so relevant to their practice and was really something that I wasn't sure would be there or not. In looking at the training and the information that the people who answered this survey had as being adequate, that is something that we do need to take with a grain of salt for a number of reasons. There's tradition in looking at any study with self-assessment, people generally over-assess their ability and over-report that. But I think this cohort probably did show with the answers and the comments that they gave that there was quite a high level of cultural competency there. The other things that also came into that, which I didn't really look at, were things like in my survey, although I got people to identify where they practiced, I didn't actually put in an AMS service as a separate area. So I think that there was, if I had included that, we could have analysed better how many people had got their experience from working in AMSs, and that would be a key thing to include in a future study. Oh, sorry, wrong way. So despite all of these great outcomes of how important this training is, and the length of time that we have had the Closing the Gap campaign from the government, and for 10 years there's been the new integrated curriculum for Indigenous studies through all the universities, we've still got the gap widening between Indigenous Australians and non-Indigenous Australians. And this study showed really clearly that GPs really want to have cultural training that is relevant to where they work, relevant to the people that they work with. And here in the Northern Territory, you can see that things for the small communities and some of the programs that I've heard about at this conference, that they're really, targeted cultural trainings. But when that same information is delivered in Western Sydney or in Melbourne, it's not really transferable. And that generalist stuff is what GPs are screaming out of that they don't want. They actually want to be able to work with the people that, they want the information to work with the people who are in their area where they live and work every day. So that's my 3 learning points. The take home would be that we need to get training that is really increased in knowledge and complexity, because there's over 500 different Indigenous Australian cultures. We need to have, we know now that the GPs really do find that medical management is governed and enhanced by having this knowledge. And I'm hoping that this research might lead to an audit in clinical education domains to meet the needs of the GPs identified in this survey. Had quite a few acknowledgements, had a lot of help along the way from a lot of different people. ACRM, AIDA, RACGP, but also my supervisor was amazing, and a couple of really key other people that I've put up there. Any questions?
Thanks. You've highlighted a really important point, and I know that you pointed out the bias that it probably is the more culturally competent people that did respond to your survey. And I wonder if your experience has given you any insights into how you could extend this to find out more about what some of the barriers are to GPs who maybe are not culturally competent, they're not providing a good service to the people in their area, but they clearly haven't engaged here. So I wonder if there's any way you can think of how you would engage those people?
In just acknowledging a couple of bits of information that I had, you know, there's so much information you get. Not everybody who answered this survey would have been really culturally competent. There was actually some really heated, really, I guess, aggressive comments that were made about having Indigenous cultural training rammed down our throat. You know, once you've seen this, haven't you seen it all? So there were some really vicious things where people took the anonymity of an online survey to express. So I do think I did capture quite a few of those. How to get more people involved. I've had some discussions with people about doing more smaller concentrated samples and different research designs around that, and possibly using local service provider networks to target and more sample those sorts of things. There's some ideas that I've had, but again, this was a 10-month student research, so being able to actually pull everything together and do the pilot study, and it was, I guess, a start. Any other questions?
Final question.
Thanks for the presentation, Kathryn. I'm interested to know, did you, in your Survey Monkey, did you test the number of years someone had been in practice? Did you try and get a temporal aspect to whether cultural safety was changing, whether things were improving?
Yes, I did. That was part of the demographical questions, and there was actually quite a range. There was also other questions in there around whether people were overseas trained doctors or Australian trained, and I actually took that back a step further. More than 80% of people who answered this survey went to high school in Australia, went to medical school in Australia, and they were in an age range from 30 all the way up to 70, and that was really quite an even spread across the age ranges. Yep. And that's all.